Health Principal Secretary Susan Mochache's name has emerged as one of those allegedly involved in the multi-billion shilling Kenya Medical Supplies Authority KEMSA scandal. This is the biggest official from the Ministry of Health so far named in the scam. Governors have in the meantime called for counties to stop dealing with the medical supplier KEMSA. NTV's Seth Olale reports that the KEMSA Board of Directors has been summoned to appear before the National Assembly Committee on Health.
The rot at the Ministry of Health stinks, and its grasp at Afya House has etched imprints of mafia dealings to the admission of the man in charge, Mutahi Kagwe. The treatment of corruption has also been seen in the Kenya Medical Supplies Authority, KEMSA, with the ministry bosses being dragged into the murky mess. Now, governors who have to buy supplies from KEMSA want to be freed from these shackles.
We want to appeal to Mutahi Kagwe not to push us into Mafia House as governors. Let Mutahi Kagwe relax the rules they have put to us so that we can be able to source our drugs from the cheapest suppliers in the market through a tender system.
With the COVID-19 millionaires expose adding pressure to unearthing the truth and bringing the quality to book, Health Principal Secretary Susan Mochache is on the receiving end of accusations of being part of the multi-billion shillings procurement scandal. She denied this.
Money from the World Bank to the KEMSA. We have not disbursed any COVID-related funds that are beyond what I have talked about. The almost 750 million and another 1.5 billion for testing kits, and the about 300 million for the masks, and now maybe another additional 100 million. And all this, because they are World Bank funds, follow a very strict procedure. So even before you buy, the World Bank must approve what you have agreed on. Before payments are made, they must scrutinize the documents before that money is wired to KEMSA. And we've only been able to transmit to KEMSA, as I indicated in the report. Actually, if you look at the report, we've only transmitted less than 500 million of all the funds available. And for one reason, the documents have not been submitted in their completeness. As they come, we process the payment. We received another one of 187, we processed the payment. There was another one that they brought of 300 million, we processed. And the World Bank must give a nod before that payment is made. So for COVID, except for the 300 million for the masks, the rest of the funding is actually from the World Bank.
A letter sent by NTV dated 11th May 2020 shows the PS directing the KEMSA CEO, Jonah Manjari, to expeditiously undertake procurement and supply the kits whose description and pricing she had already stipulated in her email, which some legislators say were inflated. The chair of the National Assembly Committee on Health, Sabina Chege, now wants KEMSA Board of Directors to come clean regarding the graft.
For them to tell us how they have used that money, what they have in the pipeline. KEMSA also generates its own income. So we want to know also whether they have used any other source of money and for what purposes. The way the contracts were done, the way the procurements were done, the companies that were given, so that we can unearth if there is any mischievous thing that have been happening. We'll be doing a report in Parliament. But what I want to assure Kenyans is that the government has its own way of auditing. And I'm very sure if there is any money that has been misused, people will have to take responsibility.
Investigations into the scandal are ongoing, with KEMSA CEO Jonah Manjari alongside directors Eliud Muridhi and Charles Jume having been removed from office to allow undeterred investigations. Seth Olale, NTV.